thank you very much for coming us, finding us, and having this operation with us. How did you find us, and what was your disease? What was your condition? Can you tell us, please?
Yes, so the symptoms that I was having was a lot of frequency, urgency, and then pain when I was urinating.
Yeah.
And then I was always getting like nothing on the
So chronic cystitis, this is a typical chronic cystitis,
yes,
right?
Correct. And so I found you because I actually was researching on YouTube,
Yeah.
and I looked up the term of squamous metaplasia,
Yeah.
and you showed up, like with all of your surgeries and everything that you did, and I was very impressed, and I wasn't able to get help anywhere else, and so I traveled all the way from the States to here.
You live in the United States,
I
right?
do.
In the Middle West, where?
Yes, I am originally from Michigan,
Yeah.
but I've been working in DC, so I flew here from Washington DC.
Yeah, Washington. Okay. Okay. So, and how did this disease started in you? What happened?
Okay, well, I believe that it started with a chronic vaginal infection that I had, which was bacteria vaginosis. Yeah. And I had that for so long. I actually just got that resolved in December of 20. From 2011.
Yeah.
To
2020.
To 2020.
So 9 years.
Chronic.
This was a chronic vaginitis, vaginal infection.
Correct.
What was the symptoms, like discharge?
Yes, discharge,
pain?
Odor.
Odor, yes.
Yes, the odor, the discharge. It literally just felt like I was walking around with a sponge all day.
Yeah. Okay.
It's terrible.
And it's also difficult because sometimes I always believe these two organs, vagina and bladder, they are neighbors, and one infection there affects the other. And usually vaginal infections pass into bladder. It's very difficult for bladder infection because you empty bladder directly. But in vagina, the secretion is over there, staying, and during sexual life, it passes to bladder.
Right.
In men, it's very rare because the urethra is longer, and there is no place like vagina holding the infection for a long time. So it's when there's a sexual intercourse, the man go into vagina, but he doesn't stay there forever. But in women, the bacteria stays there forever, and it can travel easily to bladder. So the beginning, was it an infection? Was it a cystitis attack in the initial experiences?
It was not at first. It was not. At first, it was just a vaginal infection. But I also was a smoker.
Yes.
So I believe with me smoking and a bad diet, not a lot of water,
so defense mechanism decreased.
I feel like that probably had something to do with making the tissues more vulnerable.
How did you feel that it passed to bladder, that the bladder is affected? When this happened? After 2020?
Well, after 2020, after the vaginal infection was resolved, then I was able to focus on my urgency and because I said, okay, so now the vaginal infection is resolved, but why am I still having urgency? Why am I still having frequency? Why is it
Maybe
still
they were together initially, then you were, but the vaginal part is more prominent, the smelling and the discharge. You were focused on this part?
Well, the doctors were more focused on that part. Because I believe that they were going for the easier route to treat whatever was easiest.
And unfortunately, this disease, cystitis, chronic cystitis, is not understood yet.
Right.
Yeah, it's a very big confusion in urology world. Nobody knows what's the correct diagnosis, what's the reason, what is the treatment. It's really a very difficult subject. It seems so simple. Cystitis can be treated just given one antibiotic or 3-day course, but maybe 95% of the patients heal like this, but some others, especially if a woman has discharge, vaginal discharge, we have to be very careful because it is continuous, it is long-term disease. and it will move into bladder. So then you understand there is an issue in the bladder, vaginal part healed.
I did, and then I had 2 cystoscopies, doctor. This is actually after, well, during the vaginal infection, I was treated for pelvic inflammatory disease, which I didn't have. I was treated for trichomonas, which I didn't have. Like they kept treating me with antibiotics for all of these sexually transmitted diseases that I didn't have. And so I don't know if that even made my bladder more vulnerable.
Yes, this is an issue.
See?
So did you use antibiotics for a long time?
Well, not a long time, but many times.
Yeah.
Many. I was treated for trichomonas
Like for example,
twice.
12 times did you use 12?
More than 12.
20, can we say?
I would say about 20,
Yeah.
because they kept putting me on the metronidazole
Yes.
oral pill
Yeah.
for 7
I am
days.
really not sure. I can't say, but we don't know what is the effect of antibiotic on normal bladder flora. Nowadays, we understand that there is a flora. We call it urobiome, and we don't know which antibiotics affect how.
Okay.
And what I see in my cystoscopies, the bladder mucosa, the normal bladder mucosa, which is never affected in our series in Turkey,
Okay.
in Eastern countries,
Okay.
they are very inflamed, very unhealthy
Right.
in those ladies who use long-term antibiotics. So there must be the only difference is, I think first, is it a racial difference? Is it something else? No. The only difference is they use antibiotics very long time. So I think antibiotics are killing some bacteria, some good bacteria, and this bacteria has some role in bladder wall healthiness, wellness. I don't know, but it must be something like that, because the bladder mucosas are too much affected. There are ladies who use antibiotics for a long time, and IV antibiotics, and unfortunately they are not cured completely.
Right.
If it's a solution, finding the very, very right bacteria in the very, very sensitive tests, like microgen testing, like we have such tests. If they find the right bacteria, if they kill it, it's okay. I would recommend this too. But they are always fighting with one bacteria, then passing into another. They can never stop the antibiotic usage. I think it is not good, and I really have nothing to do. I don't know. We are fighting on this, but it's very difficult to treat. They have the leukoplakia or trigonitis. We treat this part, but it's not enough. The other bladder walls are unhealthy. One of the ladies go into cystectomy. They remove the bladder. It's very, really sad situation for us.
But like with the overusage of the antibiotics, doctor, the actual resolution for the bacterial vaginosis was not even oral antibiotics.
Yeah.
The thing that worked was antibiotic gel that went directly into the vagina.
Yeah, not suppository, but gel.
Gel. There was just a gel, and then also boric acid.
Yeah.
So all the time while I'm taking which has also affected my gut health.
You know, I look to vagina after the cystoscopy with my cystoscope.
Yes.
Because, you know, gynecologists do an examination with their naked eye.
Right.
And I like to see it with
Very
camera.
good.
And your vaginal tissues were healed completely.
Right.
One of the best cervical tissue and vaginal tissues. No need. So I always see some changes. In your case, I didn't see. All healthy. And when I say to ladies, please have a gynecological consultation, their gynecologists usually say, oh, this is normal, this is not a problem.
Right.
But yours was different. Yours was healthy, completely.
Good.
The other ladies, there are a lot of different tissue. I'm not expert on it, but everybody in the operating room, what's that? They say, oh, this is different. So I think vaginal therapies are very important after cystoscopy, before cystoscopy. So they have to go together.
Understood.
So it's very nice that you solved it first. Now we treated your case, and in your case, as usual, I find the big Leukoplakia islands, which if someone is not using antibiotics continuously, usually I find this.
Okay.
In Turkey, there are many ladies, they use maybe 30 bucks of antibiotics, but not continuously. They use when needed, then stopped, then have the disease again, use the antibiotics. So, no problem. Their bladder is healthy.
Right.
And we find the leukoplakias.
Right.
But those who use the antibiotics continuously, okay, they heal the leukoplakia. I am very surprised when I see my first case. Oh, where is this leukoplakia?
Wow.
The leukoplakia part healed with these long-term antibiotics. But underneath, the unhealthy tissue, reddish unhealthy tissue, still there.
Still there.
And it is giving the irritation. My theory is like this. When the tissues has changed, we call it metaplasia, Squamous metaplasia.
Right.
That means in Latin, change of the tissue to another type of tissue.
Right.
Metaplasia is non-cancerous. It's not cancer. In cancer, tissue change becomes cancer. Here, tissue changes to another tissue, but not cancer. Metaplasia is this. So squamous metaplasia means the bladder cells are not bladder cells anymore. They are turned into squamous cells, which are the cells of vagina or skin tissue. So there is a change of tissue change.
Understood.
And now the urine is burning that part because it's not a bladder
Very
wall.
irritated.
Yeah, normal bladder cells are resistant to
Okay.
acid.
Is it like smooth? They normally are
They are smooth and they have a barrier,
Right.
mucosal barrier above themselves, and acid cannot touch into the nerves inside the tissues. But here, this is a different tissue, this is not a bladder tissue, this is a vaginal tissue-like tissue. So when acid touches to that, then it penetrates and it touches into the nerves. So there is an irritation. It's not like a knife it's some kind of distress, some kind of uncomfortable feeling.
But this is why I kept telling the doctors that I could feel like in the bottom of my doctor, I promise you, it felt like I always had a weight at the bottom of my bladder.
Something is there.
I kept telling them that.
Yeah.
I said, I can feel like there is a weight at the bottom of my bladder. And they said, oh, well, it's normal and it's normal and it's normal. And I was also concerned because my family has so many cases of cancer.
Yeah.
I've had my aunties have had cervical cancer, uterine cancer. My dad had prostate cancer. There's so many cancers. So when they said the metaplasia, and you look on the internet, although like you said, it's not cancer, but sometimes, and then my bad habits, I was smoking. So who's to say it wasn't going to turn in? It could have. So thank you so much. You have really
So
lifesaver.
really, this is the story. When I understand that we have no solution in the medical literature for this is a chronic disease, we can't treat it.
Right.
It is accepted like this. You have to give some symptomatic treatments, forget about them. So I begin to listen to the patients.
Yes.
They said, these ladies said to me, I have something in my bladder, it is like itching, something there in the bottom, they said. Okay, there is leukoplakia. We know all doctors know leukoplakia.
Right.
And we consider it as normal. And one of my patients convinced me to take it out.
Yes.
And when I take that, she healed.
Right.
Then I did it again and again. Now it's like 800 cases.
Wow.
It's 80% success. In foreign ladies, it's not 80%.
Okay.
Between 60 to maybe 70% success rate.
Okay.
I am sorry, but we are on it every day, thinking about it. What can we do? Lately, I am added ozone treatment, ozone therapies. Ozone is the gas, O2 is oxygen,
Okay.
O3 is ozone.
Okay.
So ozone is used for many chronic diseases, headaches, migraine attacks, some ear problems,
Okay.
such chronic diseases. So when you give ozone treatment, it really helps the healing process.
Okay.
So if somebody is in the 20% group, not give any response to treatment, not
Right.
recovered, I recommend them ozone
So
therapy.
you even go a step further with
Actually,
Wow.
the further step is happened like this. I operated nearly 100 cases last year from outside Turkey, foreign countries.
Okay.
And I give numbers to them usually.
Wow.
In number 45, there was a very difficult case. All the bladder was very sick, bleeding from everywhere.
Okay.
I said, oh, this I can't help this lady.
Right.
She will not respond. She will not recover. I think, what can I do? What's the problem? So the bladder walls are ill.
Right.
I made the same fulguration that I made to trigone only till that case.
Okay.
To other parts of the bleeding parts, unhealthy parts, to make a healing, to induce a healing in that part. Because
Right.
when I fulgurate, the tissue burned
Yeah.
and new tissues come over
Right.
it. So I said, and this lady response was very nice.
Wow.
She recovered. And then we are talking with her now. She says, yes, my urinations was raised from 1 hour to 3 hours. I was an ice skating teacher. I was not doing my job for years. Now I turn back to my job. So
It's very debilitating.
yeah, it's a social cancer.
It is. It's very debilitating.
So lately I improved the procedure a little bit. If the bladder wall is unhealthy, I make some little punctate fulgurations in these other parts of the bladder, and the ozone treatment addition is, we are on it. I am learning from the patients still.
But that is the key.
Yeah.
You listen to us.
Yes.
I have seen so many doctors, they don't listen.
Yeah.
They go off of what they, and because with mine, and I believe it was the same bacteria that was causing the bacterial
Yeah,
vaginosis,
sure.
like you said.
Yes, of
So
course.
by mine having the odor,
Yeah.
I was literally walking around all day smelling like an infection,
Yeah.
literally.
Yeah.
And so they couldn't get out of their mind that it had to be the vagina. And I kept telling them, it's not the vagina anymore. We've cleared that up. Now the bacteria has moved to my bladder. That's the problem.
Yeah.
And they would not listen to me. They just kept testing me for sexually transmitted diseases. The cystoscopies were like, the last one was just like.
What they say in this, because people ask me, hey doctor, I had the cystoscopy. What will you do different than this cystoscopy? So what's your comment? What was your cystoscopy, and
So
why
what-
didn't they?
The first thing I noticed off the bat when I watched your videos versus the cystoscopy that I had, even previous to the more recent one that I had, which I knew what to look for because I watched your videos. So I was educated going in. I wasn't going in blind like I did for the first one. But the first one, I noticed she went around, she looked at the dome, she looked at the orifices.
Yeah.
She did not pull back and look at the trigone. She did not get the angle like how you said. You said, this is awesome. Your videos were so awesome. They're so amazing. They're helping so many people. Had I not seen these videos, doctor, I would still be walking around. I had taken this, I had started to accept this as a life sentence. Had I not seen your videos and been able to come here and be treated by you, the doctors had written me off. Even the last cystoscopy that I had, where I went in, I was educated, I knew if she doesn't, when the doctor first went in, I saw all of this like white matter floating around,
stuff.
and I asked her, I said, what is that floating? Oh, that's just debris. It's normal.
Yeah,
what she
debris
told
is
me.
not normal. Debris, or we call it, it's written as debris. So debris is infected particles. It's not present in normal people.
This is what they're telling me. It's normal. Okay, now, when she got ready to pull back, to come out, to look at the trigone and to look at the urethra, the camera popped out and she said, oops. And I said, oh yeah, we're done. Because I had already made up in my mind that I was coming to see you. That was the last
Actually,
part.
I can understand. It was a flexible cystoscope, and it is very difficult to manipulate this. And urethra in ladies are short. It's short, and when you try to come back, sometimes you can come off. It's not a fault, actually. I can't say. I am really very sorry about this situation. I don't know I'm really sad and sorry that people don't understand doctors. When one of my patients watch this video, they say, okay, this is me, they understand. I try to make the doctors, please see what I'm doing this, and they are really giving too much good benefits. They say, oh, did you find it? Well, why it's not written in the literature, in the books? It takes time for the books to accept this. Nowadays we are conducting a study. I hope this study will come out.
I hope so too.
But it's also not easy for Western medicine to accept some paper coming from Turkey. So
Understood.
I hope one day one doctor from States will see and believe that this is working and will do, and in a university will make a bigger study. Okay, so now in your case, we have to put the catheter for 2 or 3 days, because the urethra was a little narrow.
Right.
I have to dilate the urethra to go in. So
Okay.
you may have a difficulty in the voiding after the procedure. So we put together. How was it? Was it painful?
It was not. Just felt like pressure, just slight pressure there. But I was emptying well. I want to say right after the procedure, when I woke up, I had maybe about 500 ml in the bag.
Yeah.
It was a little blood, not very bloody, just a little blood. And then after that, I was drinking water and tea and water and tea. And the urine cleared out. It was just almost like clear, like not even yellowish, but everything. And I was just emptying out, and I probably emptied out my catheter bag maybe like 4 or 5 times during the night. Up to 500 ml.
So is it tolerable to stay with the catheter at that night, and after the night you were at the hotel with the catheter?
No problem.
Yeah. So we removed it now. Of course it is very early, you can't say anything, we will see in the follow-up, but do you feel any difference, anything
The
to say?
pressure is gone.
Yeah.
The pressure is gone. Like the first day, there was maybe like a slight sting, probably from this cut.
Yeah.
But after that, maybe like after 4 or 5, 6 hours, that was gone. So everything is fine, doctor.
Yeah. So in the follow-up, we usually give some medications, some supplements, like to prevent the cystitis attacks.
Okay.
I don't know if they are necessary or not, but it's good to have some spare boxes of medications with you.
Okay.
And in the follow-up, we don't want to use too much antibiotics. And in the first year, you may have 1 or 2 infections. It is normal.
Okay.
So I give some spare antibiotics with you. If you have, you will always inform me, and we'll use these. So, so you are coming from States, and it's possible to come and to do this, and you will go back to, I think, not other than tomorrow.
Back to DC. I'm leaving back to go to DC tomorrow. And I wanted to make sure that I checked with you to see if I needed to come back in 6 months, because if I needed to have if you felt like I needed to have another cystoscopy in 6 months, I was going to come right back here and have you finish my treatment. I'm not interested in seeing anyone else because no one was able to solve the problem.
Actually, it's not a difficult thing. You can also have the cystoscopy there if needed. We will follow up. We will discuss your symptoms. Sometimes you will have no need, and you will never want to have it back again.
Okay.
So we will not do it. But if you have some symptoms, some discomfort, of course it will be necessary.
Okay.
Then at that time, we will discuss it. You can do it there. You can come. We will be more than happy if you come back and to do it here. But I hope it will not be needed again. So thank you for coming. Thank you for explaining all the things I learned from my patients, and the patients learn this way.
Right.
They listen to the people which have the same symptoms. So thank you very much.
You're welcome. Thank you, doctor. Thank you.